Hello, my name is Ezekiel Oburu. I am an orthopedic surgeon partnering with Ponea Health. I work at Nairobi Spine and Orthopedic Center, and today we'll be talking about osteoarthritis. Osteoarthritis is one of the most common orthopedic conditions. It is a degenerative condition involving the joints where you have the cartilage, which is found at the end of your bones. One bone articulates or forms a joint with the other, and this wears off and leading to pain. There are many joints that are involved in osteoarthritis. There are different joints in the body. The one that's commonly involved in osteoarthritis is the synovial joints. And synovial joints can be anywhere in the ankle, in the foot, in the hips, the knees, the hands. The ones that are most commonly involved in osteoarthritis are the ones of the knees, the ones of the hips, the ones of the hands, and sometimes the spine. A number of times osteoarthritis may be idiopathic, and that's a big medical term that we use when we just do not know what has caused the osteoarthritis. But there are certain risk factors. Number one, age. The older we grow, the more the chances of getting osteoarthritis. Number two is gender. I cannot really explain why, but the female gender are more prone to osteoarthritis. One of the treatments of osteoarthritis that we'll go into later is joint replacements, and when I do a hip or a knee replacement, most of the time the patient, I can say off the top of my head, maybe I would say about 60, sometimes 70% of the times the patients are female. Obesity is one of the things that we can actually prevent that causes osteoarthritis. And then there's trauma. You can have patients who are involved in trauma, like let's say a broken bone around a joint. When the joint is not aligned properly, that may also lead to osteoarthritis. Most of the patients that I see with osteoarthritis are patients who present with pain in the hip or the knees. Those are typical patients that I see. And usually the patient will say, the doctor, I'm having problems with pain in my hip, I'm having problems with pain in my knee, or I can't walk for very long. So the walking distance, initially they say they can go for 5 kilometers, but sometimes it can become so severe that they can hardly go for even 100 meters. So you find that they find it really difficult to walk those distances. And then the other things that you take for granted, we call them activities of daily living in orthopedics. So they will tell you that, doctor, I can't even tie my shoelaces. When I try to tie my shoelaces, I find that I am in quite a bit of pain. When I bend, then I cannot go to the toilet and rise up from a toilet seat. I cannot take the stairs. I cannot get in and out of the car. You know, in our setup where people's religious lives are quite important, sometimes they tell the doctor, I can't even go to church. You need to see a doctor first, like you said, you know, to determine what would be the best course of action for you. Some of the things that you need to deal with is, I think, first to prevent osteoarthritis. And like I've said, part of it are factors that you can do something about. Part of it are factors you can't do anything about. For example, you cannot change your gender, isn't it? Or you cannot avoid the clock of time, or you cannot stop the clock of time. So you will eventually get old. But you can control your weight. So if you reduce your weight, that will help in alleviating some of the symptoms. Then the other home remedies that can be used, not many. The science is changing. There are certain things that in the past were not advocated or prescribed, but certain, over-the-counter things like some supplements have actually shown to be useful. We can't explain why they're useful. The guidance up to a few weeks ago was that they were not useful, but current guidance shows that they may actually be useful. So certain supplements can be useful. Thank you for joining us in this episode in conjunction with Ponea Health. We look forward to seeing you in the next episode. Find our services at ponea.com.